Good evening to all the spectators and organizers and the participants of the conference. So the topic I have been adopted is a simulation of a mental status examination. Is going to be a novel teaching approach. We all know like the mental status examination for teaching about the medical, nursing, and all the different category of students. It is a very vital aspect. If you help out to change the slides, it will be, if you go to the next slide, it will be helpful. Yeah, thank you. So innovation in the teaching methods is a very important factor for an effective teaching. So always the students prefer various teaching methodology. It's not like to be a single method of teaching. We want to have a different teaching methodology. So in that, we commonly focus on simulation. But when we say on simulation, it's more to focus on the medical and medicine and surgical aspect alone. But simulation is also going to be the very good teaching methodology when you adopt the same in the psychiatric setups. So the simulation will depict the real life situation, and it helps the students to understand, interpret, and analyze the subject in a better way. Often the student find a difficulty in understanding the mental status examination since the diagnosis mimics the same, whereas the student has to understand the differences in a correct manner. Next slide, please. Yeah, the simulation will help the nursing students and all the paramedics, medical students to develop their skills to interpret the findings, self-confidence, and their satisfaction with their learning ability. This will also improve their self-confidence and assumes to improve their satisfaction with the learning process. So next slide, please. So what is this mental status examination? It is an assessment which has been performed for the patients or individuals to assess their present mental status, which involves what is their present mood, thought, speech, perception, cognitive functions, and insight. So next slide, please. Why we want to do a mental status assessment in a patients? To assess their mental status, it provides the guideline or the pathway to decide the treatment modalities, like what treatment is required, and we can also prioritize the treatment, what treatment has to be first and what treatment has to be the next. It helps to diagnose the patient condition. It aids to assess the improvement in the patient condition with the present treatment regimen. Next slide, please. Yeah. So what are the different aspects of the mental status examination? It is the general appearance and the behavior. So that is the facial expression, eye to eye contact, the posture, the speech, that is nothing but the coherence, relevance, and the reaction time in speech. We also assess their mood and affect. So mood is subjective, like what the individual feel about it, whereas the affect is an external expression of their emotions. So we will check the affect is appropriate to the mood or not. Is it inappropriate? Suppose the patient says, I'm happy, but patient looks sad. That means the affect is inappropriate to the mood. And we can identify, is it going to be the pleasurable mood as the patient is manic, or it's a non-pleasurable mood as the patient is depressed. We can able to assess the same. Next slide, please. Yeah, so we can also assess the thoughts, and the thought will assess the form of thought, stream of thought, and content of thought. The form of thought, which helps us to assess the formal thought disorders, is the what the patient conversation is normal, or it is not understandable, or it may be a circumstantiality, like a patient can reach the central point after giving up some sort of a tedious details, and then patient can come to the conclusion. It may be a tangentiality, whereas the patient does not come to the conclusion, where patient may have found the new terms, that is the neologism. Patient can have the different group of words together, which does not have a proper meaning in it. It may be a word salad, and perseveration, a persistent repetition of the same words towards any sort of question which has been arised. Or you can also assess the ambivalence, whereas a patient has an emotional conflict either to do these or not, like that. And we can assess the stream of thought, or the flow of thought, which is nothing but the pressure of speech, or a patient may has the or a flight of ideas, that is the rapid shift of one ideas to another ideas. Patient does not talk. So we can assess the thought retardation, because since the patient doesn't getting the thoughts, so patient cannot speak out well. And patient completely absence of speech is going to be mutism. Patient speak, but there is no sound was produced. It may be aphonia. And we can also assess delusion in the content of thoughts. So delusion is a false, fixed, unshakable belief, irrespective of their socio-cultural futures. So that's a delusion. We can also assess in the mental status assessment. Yeah. Next slide, please. Yeah. So in regard to the disorders of perception, we mainly assess the hallucinations and illusions. Hallucinations are the misperception without an external stimuli, whereas an illusion or the same, the misperception, but with an external stimuli. So we can assess the different category of hallucinations. It may be auditory, olfactory, and visual, extra campaign, etc. Those we can able to assess the different types of hallucinations in patients. But the common with the psychotic patients will always have an auditory hallucination predominantly. And in regard to the cognitive functions, we can assess the attention and concentration of the patients. We have a digit span test, digit forward test, and backward test. So is the patient is able to repeat the span of numbers immediately or not? Patient is able to do some simple subtraction or not. From that, we can come to the conclusion about their attention and concentration. And we can assess their memory status of patients, that is your immediate, recent, and remote memory. And we can check how far the patient is going to be oriented in regard with time, place, and person, and how about the patient general intelligence, and what is their abstract thinking. We generally used to give a proverb, and we ask the patient is able to identify the hidden meaning which is in the proverb or not. So from that, we'll assess the abstract thinking is intact or not. And the judgment, and we can assess their personal judgment, like after the discharge from the hospital, what the patient is planned to do, and how far the patient is socializing with others. We can assess the social judgment. And we also have some test judgment, like we have an envelope test, child cry test. Okay, so if a child is crying, you were able to watching it, what is your action? If the envelope is in the road, what will be your action for that? So we can judge the patient what is going to do it out of it using some special test. And at last, we assess the insight of the patient, like how far the patient is aware of one's own mental illness or not. So next slide, please. So what's the novel approach that we can adopt to teach to the mental status examination to the students? So there are a lot of research has been done in regard with the video simulation, but using up of one particular sense in a wise mood by the students will help them to have hear of the different abnormalities. See, it's very difficult difficult for a student to see all the abnormalities in a single patient. It cannot give them a lot of confidence to identify, to make up the inferences. Instead, audio simulation techniques we can adopt them to teach to the medical and the nursing students will help them to identify the inferences. So I can able to search up a lot of review of literatures or existing in regard with the simulation, but it's focused on the videos, but not on audios. So my research study is mostly focuses on the audio simulation technique, like how far it is going to be effective in identifying the inferences in regard with their mental status assessment for the patients with the different disease conditions. So the pre-recorded case scenario audio tapes was being played to assess the skills to interpret the alteration in the thought, perception, and cognitions. There are some short case scenarios. We cannot incorporate all the entire mental status examination, but we can take the very vital part of the mental status where we can have the lot of abnormalities, mental status abnormalities in the patient. So each sections has thoughts, cognition, and perception can be given up to the participants in online with the stipulated timings and make the participants, the research participants or the students to diagnose those particular conditions based on the case scenarios. So next slide, please. Yes. So these simulation techniques, these audio simulation techniques will going to be very useful in terms of your medical and nursing education. And the same what the education what we're teaching, this simulation is going to be the real life situation for the when they become medical graduates or the nursing graduates. So it is also going to be implied in their practice, in their medical and nursing practice also. Next slide, please. Yeah, so the take home message, like what I would want to share to the delegates, or the simulation will help the students to develop their skills to in order to interpret their findings, self-confidence, and the satisfaction with the learning ability. Since the abnormalities or the inference of all the findings cannot be identified in the real situations, the simulation teaching, either audio or video or combination of both, are highly helpful for the student learning process. So thank you, and thank you all of you for this great opportunity and listening my session. So if you have any queries, and you're welcome to discuss.